This is part 2 of the Principles of Manual Muscle Testing lecture. We're going to be talking about the considerations in manual muscle testing, including positioning the patient, stabilization, test position, and pressure application. Just as an aside, we're doing these in different parts just to keep the sizes of the files a little bit smaller and make it easier to manage for your computer. So for positioning the patient, we need the patient really stable. We're going to talk about stabilization in just a second, but when we're asking the muscle to perform in a way that we can test and to see the strength, we want to make sure that the person's not trying to stabilize a lot of different parts of their body. We just want to be able to test the muscle itself, to isolate that muscle. And you can see here, this is actually Dr. Henry O. Kendall, Florence's husband. He is obviously testing the hamstrings, one of the hamstrings. Can you figure out which hamstring he's testing? Is it the biceps femoris, the semitendinosus, or the semimembranosus? Okay, if you said biceps femoris, you're right. He has the tibia is externally rotated, and you can see on the lateral aspect of the knee the biceps femoris tendon. Anyway, the person is prone, which is a very stable position because it stabilizes the rest of the body. He doesn't really have to worry about stabilizing the trunk or the pelvis because just by virtue of the position, the body's already stable. So here we see that positioning can fixate or stabilize much of the body segments. In addition, he has his hand on the hip area to additionally stabilize the pelvis, and has the body in a position that he can easily visualize the muscle. So prone is a good position for this test of the hamstrings because he can visualize it and the prone positioning stabilizes the rest of the body. It also allows the muscle to function against gravity. So which way is gravity going? Right, down. And the hamstrings flex the knee, so they pull the knee up. And prone allows the hamstrings to flex the knee against gravity. In this position, we see the person is sitting, and that's a stabilizing position because you can see that the person is hanging on as well, and as long as they're able to do that, that's perfectly fine. You can see here these are Florence's hands, and you can see that she is stabilizing with her hand against the medial aspect of the knee. So she is testing the external rotators of the hip, and you can see the person is able to externally move the leg out into external rotation, move the hip into external rotation against gravity. And then again, Florence is stabilizing on the medial aspect of the knee in order to apply resistance and isolate that to the external rotators of the hip. So just in summary, we need to position the patient so that the body itself is stable and so that we can allow the muscle to function against gravity. Secondarily, we have to stabilize using our own hands against either the trunk or the proximal body segment so that we isolate muscle action to just the segment that we're testing. If we look at test position, we again have to look really closely at the issue of gravity. One of the things that we're trying to do with muscle testing is to see if the muscle can hold or to support the weight of the limb against gravity. And you're going to see when we talk about grading that we need to be able to first try the muscle against gravity and see if it is strong enough indeed to hold the weight of that limb. You can see in this position the difference between testing a one-joint and two-joint muscles. When we have a one-joint muscle, in other words, a muscle that only crosses one joint, then we want to test that in the fully shortened position. When we have a two-joint muscle, in other words, muscles that cross more than one joint, muscles that can become actively insufficient, we don't test them at the completely shortened range. We know, because of the length-tension relationship, that a muscle that crosses more than one joint that becomes fully shortened is going to demonstrate much less force production capability. And to get an accurate assessment of the strength of a muscle, for a two-joint or more muscle, we test that in the mid-range. So what you see here on the left is, well, let's actually look on the right in B. what they've done is showed you the sitting test for the iliopsoas. We know that the iliopsoas also crosses the lumbar spine and the pelvis, but for the purposes of testing, it's only crossing one extremity joint. So the person is sitting, they're stabilizing themselves with their hands, so the hip flexors, the iliopsoas, is working against gravity. The examiner, Florence, is also stabilizing the trunk, and then she's going to apply resistance down against the knee to pull the hip into extension. But she has placed the hip into a lot of flexion to test the iliopsoas. By contrast, on the left, they're testing the hip flexors as a group. Can you see if you can list 3 hip flexor muscles other than the iliopsoas? Okay, so did you come up with sartorius, rectus femoris, pectineus? That's all I can come up with right now. Those muscles all cross not only the hip but the knee as well. And so in order to prevent them from becoming actively insufficient, the examiner has put the person's hip more in the mid-range position to do that testing. This is not something you have to try to figure out on your own. I'm going to be giving you really specific directions for each muscle or muscle group that we're testing so that you know exactly what position you put these in. I'm just going through this so you see the rationale or the intention behind the positioning, and also so that you appreciate the necessity for being precise about the position. We've talked about validity and reliability, and we want to make sure that we are being precise in our positioning so that we can be both valid and reliable. The last thing that we need to talk about as far as test position is placing the body in the horizontal plane, which is what we call the gravity eliminated position. And we do this to test a muscle that is too weak to hold the body limb against gravity. And so we're always going to try gravity first, and then we have to know what the gravity eliminated or the horizontal plane position is. And I will talk more about the horizontal plane testing position in lab, and you'll also see that on your lab sheets. The last thing we're going to talk about then is pressure application, and we're going to talk about how you apply pressure, where you apply pressure, and one of the things I think people struggle with the most when they're first learning muscle testing is how much pressure to apply. And this is something that we're going to be helping you with in lab. You'll practice on each other and you'll give resistance to your partner. Then one of the lab assistants or I will come over and we'll do it, and then your partner will be able to tell you if you need to press harder or if you need to press softer. So it's going to be kind of a combination of pressures. And you can also do your testing on any of the faculty so that we can give you some feedback as far as your pressure. Because this is manual muscle testing, one of the major ways that we're grading is by the amount of force that the person can withstand, but it's the force that we are applying with our hands. We're not using anything that actually measures the direct amount of force in pounds or in newtons. So the force is not as hard as you possibly can push, and we'll get into that more when we get into grading. We do need to apply it against the line of pull of the muscle. So if you see here, see if you can figure out by the patient's position, they're supine, their hip is in flexion, a little bit of abduction and internal rotation. And also look at the proximal end of the hip. See if you can figure out what muscle is being tested here. All right, well, I also didn't mention on the left lower hand of the slide is the little drawing of the muscle. This is the tensor fascia lata. So it does hip flexion, abduction, and a little bit of internal rotation. And you can see the muscle bulk coming out in the lower right-hand area of the slide where the arrow is. What I was trying to illustrate, though, is that the examiner is resisting using what we call a long lever arm. He's also applying resistance against the line of pull of the fibers of the muscle. So you can see the line of pull of the fiber of the muscles, and you can see that the limb and the hand are positioned directly along that line. so that the muscle has the best chance of working and it's challenging the muscle optimally. You can see that the person has their hand flat and they're actually not even using their fingertips to press into the body part, but their hand is very flat and broad and they're using the soft part of the hand so that they're not creating any discomfort. You can see that on these other pictures as well, using a very broad application of the hand and not using just the tips of the fingers or a small area of the hand. So we want to diminish pressure. You also see that there's not pressure directly over any of the joints. In this picture, the pressure is just proximal to the ankle. On the left-hand side, just proximal to the knee, and also that on the right-hand side. Though the heel of the hand is cupping kind of over the patella, the pressure is actually coming from the fingers. So we want to make sure that we're not putting pressure over the joints themselves because we don't want to create force or pressure on those joint surfaces. Here's one more illustration. See if you can figure out what muscle is being tested. The person obviously is in flexion and they have the leg a little bit externally rotated. This one I don't think is as obvious. This is actually testing the iliopsoas. This is a supine test position for the iliopsoas. And you can see that the examiner is clearly adding to the supine stabilization by putting a lot of force on the opposite iliac crest. And then again using that long lever arm. Picture the fiber direction of the iliopsoas coming from that lesser trochanter, kind of up and in toward where you can see that man's umbilicus. That would be the fiber direction. So you can see the leg has been angulated. Even though the hip or the iliopsoas doesn't abduct, the limb has been abducted in order to allow the examiner to apply pressure along the line of the fiber of the muscle. So this brings us to the end of the second segment of the muscle testing presentation. And when you're ready, you can go on to part 3 where we'll talk about grading and procedure.